I think two key words is preparedness and response. On the preparedness side, it is obvious from the COVID saga, we could do more in actually profiling our risk so that our policymakers can make informed decisions. And that's the reason why it was the Africa CDC with a lot of emphasis and resources into actually risk profiling our countries so that we can come up with the mitigation. I think second, most of our countries in Africa, because they didn't invest much in the healthcare sector, has a huge impact on the contingency plan so they can respond as opposed to waiting for the international community to come to our support. And I think last but not least, the coordination within our African government was such that the response was quite delayed, and that has an impact on saving lives and livelihoods. I think on the response side, the lack of innovation that we have in actually responding to a pandemic is such that unless the international community come to our support, unfortunately, we find ourselves we're not responding adequately. And last but not least, we know when the situation got so challenging, a lot of countries actually just basically focus on their own response as opposed to helping Africa. So this is, I think, an opportunity. We come up with African solution to African problems, and that's why I'm super excited with CDC. We're thinking about how do we prepare better, how do we respond adequately, so no one is left behind.
Now, with some arguing that we are already pre-pandemic with a lot of issues in the healthcare not being taken care of, are we not then starting this framework already on the back foot?
Well, it is clear that there's a lot that we learned from COVID-19. Now, whether we've taken all those lessons and turned it into a solution is a long way to go. But the conversation we're having today on the sideline of the BRICS, it's a good starting point because now we're talking about what do we need to do differently on preparedness. And I think second, will we be ready at the next pandemic? The answer comes from basically what we come out from a conversation like this so that we can spend more resources, more time, more technical expertise into preparedness. And in preparedness, I want to underscore in particular, not just the financing side, but the technical side, and that is the risk assessment in mapping the risk to know what are we exposed to as a country. For example, in Africa, 50% of our actually pandemics, we can anticipate them. And that sense of anticipation really allows our countries to come up with the right policy decision and eventually be able to save lives and livelihoods. So we'll know when the next pandemic is here how prepared we are. But in the meantime, we can use the lesson that we learned from COVID-19 and make sure that our preparedness, it's not just the word, but we walk the walk and talk the talk so that eventually Africa will be better prepared.
And now the summit is closing with 6 new countries joining in Africa or from Africa, Egypt and Ethiopia, which have relatively large populations. What role will they play in shaping this framework?
Well, first of all, kudos to South Africa by putting the rest of Africa on the map at the BRICS and making sure that BRICS is actually relevant to the African continent. I think that's something that South Africa should be congratulated for leading that Africa involvement in the BRICS conversation. And the fact that Egypt and Ethiopia will accept them, I'm hoping it's just the beginning of a process to get other African countries coming in. Now, let's face it, the numbers are extremely impressive. The numbers in terms of the markets, in terms of GDP, and the BRICS and now BRICS Plus is such that now going forward, as BRICS Plus actually interact with the rest of the world, we have the power of the market, we have the power of these economies, and let's hope that also will make the BRICS Plus be more powerful as we negotiate with the rest of the world, G20, G7, and so on. So I'm hoping other African countries will see the benefit of BRICS and begin to actually be part of the process. Now, whether you're a member or not, we don't have to wait to be a member of the BRICS to be able to actually be part of the solution. So the conversation we're having today on the healthcare sector is a way of making sure BRICS is actually relevant to Africa, and I could not think of a better active sector to be relevant, and that's outbreak and epidemics, so we can save livelihood.